Hello everyone. In this video we're gonna be talking about the pathology of alcoholic liver disease. So let's start. So this is the most common cause of cirrhosis worldwide. You should not be drinking alcohol at all, but if you're planning on doing so, you shouldn't drink more than 80 grams of alcohol in one day. So 80 grams of alcohol in one day is the threshold. Also, women are more susceptible to alcohol-induced hepatic injury. So if there are two people, one is a male and one is a female, and both of them are drinking the same amount of alcohol, the lady will have a higher chance of developing this hepatic injury. Now, what are the clinical features of this disease? So there are three stages in this disease, but it is important to note that the stages are not exclusive and separate from each other. The symptoms usually overlap. So the first stage is the alcoholic steatosis, the second stage is the steatohepatitis, and the third stage is cirrhosis. Now let's see these stages one by one and their characteristic features. So starting with alcoholic steatosis. This is characterized by fatty changes inside the liver cells, and due to this, it is also called as fatty liver. So this is an early change seen in this disease. And the good thing is that the liver injury is reversible. So if a patient is determined and quits alcohol completely, he or she can completely recover from this stage. So microscopically, you are going to see fat droplets inside the liver cells in this condition. So this stage can be divided into two types, microvesicular and macrovesicular. Let's look at them individually. Starting with microvesicular, so as the name suggests, micro meaning very small lipid droplets in the hepatocytes are going to be seen. Additionally, this can also be seen in conditions such as fatty liver of pregnancy and Reye syndrome. So it is important to remember these conditions as well. So this is a microscopic picture of the liver cells. Here you can see the white circles. So these white circles are actually lipid droplets inside the hepatocytes. Next, talking about the macrovesicular steatosis. So as macro is in the name, here there are going to be very large lipid droplets. They are going to be so big that they can even push the nucleus to the periphery. This can also be seen in other conditions such as obesity, total parenteral nutrition, and diabetes mellitus. So this is a picture of the hepatic tissue. Here also you can see that there are white circles, but they are much bigger. So these white circles are also the lipid droplets. Comparing the micro and macrovesicular steatosis, you can appreciate that the fat droplets in the macrovesicular steatosis are much bigger than those in the microvesicular steatosis. Now let's jump to the second stage, which is steatohepatitis. So in this condition, you will see ballooned hepatocytes. So these are injured and swollen hepatocytes. And these injured hepatocytes contain Mallory-Denk bodies. So Mallory-Denk bodies I've talked about in my previous videos as well. So these are seen in a lot of conditions and one of them is this. So what exactly are Mallory-Denk bodies? These are partially degraded intermediate filaments such as keratin 8 and 18. So this is important to note since they might ask what is the composition of Mallory-Denk bodies. Now in this condition you can also see perivenular fibrosis, which is a deposition of collagen around the terminal hepatic veins. This is also given the other name of chicken wire fibrosis. So this is the picture of the chicken wire and the fibrosis seen in this condition resembles this shape. So this is the picture of the fibrosis seen in steatohepatitis, and now you can compare these two pictures and you can see that there is a resemblance between them. Coming to our last stage of the disease, which is alcoholic cirrhosis. This can also be divided into two types, the macroscopic and the microscopic cirrhosis. So in macroscopic cirrhosis, diffuse nodularity of the surface of the liver is seen, which is approximately 3 millimeters in size, and the liver will have a greenish tint to it because of cholestasis, which is when the bile is not released from the liver. Now in the microscopic type, you will be able to see small nodules entrapped in fibrosis, and the color of the fibrosis will be blue, as we saw in the previous chicken wire fibrosis picture also. There the fibrosis was blue in color. And for this, we use a Mason trichome stain. So this is important to remember. So in this picture, we can see the macronodule. We can also see the small micronodules, and the fibrous septa, which is blue in color, is entrapping these small nodules. Coming to the last part of the video, a few important points that you should remember regarding this condition. So the ratio of AST to ALT is more than 2. So in most conditions, it is exactly opposite. The ALT to AST ratio is more than 2. But this disease is an exception in that the ratio here is reversed. The alcoholic liver cirrhosis is also known by its other name, which is NExT cirrhosis. And the last point, which most of you already know, is that once there is cirrhosis of the liver, then the liver cannot return to its normal form because its condition is unfortunately irreversible. So that's it for this video. If you have any doubts, so please leave them in the comments, or you can text me on Instagram anytime. The link for the Instagram is in my bio. Thank you.